right, let's go over chapter 16, deciduous teeth now, okay? All right, so our objectives for this chapter, and this is what you want to get out of it, is to identify the various deciduous teeth, to recognize whether a tooth is primary or secondary, to know the eruption dates of primary and secondary teeth, to understand the essential differences between deciduous and permanent teeth, to understand the importance and functions of deciduous teeth, and to compare dental anatomic features of deciduous teeth with other deciduous teeth and with their permanent counterparts, okay? So, permanent teeth, we do have 20 primary teeth. And remember, we have 32 in our permanent dentition, so 20 in our primary dentition because we don't have the 3 molars in the back, okay? So our primary dentition consists of 2 incisors, a central and a lateral, a canine, and then 2 molars. There are no premolars in the deciduous dentition. As far as exfoliation, exfoliation is the process where the primary teeth are shed or replaced. And this begins at 2 to 3 years after the root completely forms. So then the root resorbs and the tooth falls out. So we finally get our root to form, have it for a couple years, and then it starts to resorb, meaning kind of dissolve in a way, okay? And then that is what allows the tooth to fall out, because with a root it wouldn't fall out, okay? Primary teeth eruption. The entire process takes 2 to 3 years. The central incisors generally are erupting at 6 to 12 months. The lateral then come in, and those are 7 to 13 months. Then the first molars, the canines, and the second molars, okay? And you can see the months there. Primary teeth. In general, they do resemble the permanent teeth with one exception, and that's the primary first molars. They don't resemble any other tooth, okay? The second molars often resemble the first molars of the permanent dentition, but that first molar, deciduous molar, doesn't look like anything else, okay? So generally they resemble the permanent teeth. The crowns are a little bit shorter. Of course, their mouth isn't going to open as wide, so they would be shorter. They're also whiter, and that's because there's less dentin in them. They have bigger pulp chambers and less dentin, okay? The space between the teeth grow as the jaws grow, so if they have space between their teeth, they're just going to get a little bit more, okay? If they don't have space, their jaw will grow and allow more space. And this is just to leave room for the larger, more permanent teeth, okay? So what are the differences between deciduous teeth and permanent teeth? The anterior teeth are going to be smaller in crown and in root portions, okay? Their mouth just isn't big enough, right? Molars are going to be wider mesiodistally, okay? So that means when you're looking at it, the buccal is going to be wider. Then they are buccal labially, okay? Roots on the anterior teeth do appear longer and more slender in proportion. And the root of posterior teeth are very narrow at the CEJ. And the root trunks of molars are really short. And that's just for less to be resorbed, right, when those permanent teeth are coming in. The cervical ridge at the cervical third is definitely much more prominent in all of the primary teeth. All right, so essential differences continued. The buccocervical ridge on deciduous molars are much more pronounced, okay? So you can kind of see here, it's much more pronounced, okay? It's going to have a more narrow occlusal table. So when you're looking at the occlusal surface, it's just going to be a little more narrow. Usually lighter in color. The pulp chambers are relatively large. Pulp horns are much closer to the enamel. And that's significant because if a child gets decay in that pit, it's going to abscess quicker, okay, because their pulps are so much bigger and those pulp horns are so much bigger. Dentin between pulp chambers and enamel is much thinner, and the enamel is relatively thin and consistently deep. So thin, but goes in deep. So importance of deciduous teeth. Deciduous teeth do maintain a place for the permanent teeth. So it's important that they are there. Remember, if you don't get a primary tooth, you aren't going to get its successor. Okay, so if it's missing in the primary dentition, it's going to be missing in the permanent dentition. This also allows for bone growth of the dental arches, and as the bone grows, it develops these spaces, and we're going to talk about those spaces. So the primate space is the space between the maxillary lateral incisors and canines, or between the mandibular canines and first molars. So the canines on both sides, maxillary, it's going to be between the lateral and the canine, and the mandibular, it's going to be between the canine and the molars. Okay? So here we go. Let me see if I can get a pointer here. Pen highlighter. I don't get a pointer here. Okay, so I guess I'll use my highlighter. Leeway space allows for extra margin of space for permanent canines and first and second premolars. Resorption of deciduous roots helps guide the eruption permanent replacement into the proper location. So if we have to take those teeth out early, the tooth doesn't have the guide. The permanent tooth doesn't have the guide. So I know for me, they had to pull some teeth when I was younger, and my premolars came in towards my tongue. They just didn't have enough room, and they didn't have that guide in there. Resorption of the root. Okay, if deciduous tooth is missing, the permanent tooth is missing. And if the deciduous tooth is compromised by decay or improper restoration, it may not leave enough room for the permanent replacement. Okay, so here's the primate spaces that we were talking about. And while there are gaps between teeth, I want you calling these primate spaces. Okay, these are not diastemas. They are diastemas, but the proper term is primate space. Okay, and then leeway space is just as that arch is expanding, all of these teeth are going to get space in them. Okay, so I want you to know that you need to use the exact terms. Okay. All right, maxillary central incisors. We have the labial aspect, and the mesiodistal diameter is greater than the cervico-incisal length. So this here is going to be greater than this measurement. Okay, I got my Swedish colors here. All right, so this is going to be longer than this. And notice that there are no mamelons present. Okay, this is a nice, smooth incisal edge. Oh, we can't see. Let me turn off the camera here. I think I can. Okay, so we can't see the lingual aspect. This is going to be a problem later on, so let me just see if I can fix this quick. There we go. Okay, so here is our lingual aspect, and the crown shows really well-developed marginal ridges. So let me just mark these marginal ridges. Here we go. Right here. See how well-developed of an outline, of an outline this is. Very nice, right? And then a well-developed cingulum. And let's put that in green. Here's our well-developed cingulum. And when we have such a well-developed cingulum, we're then going to get well-developed fossa. Okay? And those are right here. All right, maxillary central incisors, the mesial and distal and incisal aspects. The mesial and distal, the crown appears thick even at its cervical third. The mesiocervical curvature is greater than the distal curvature. And then on the incisal aspect, you're going to notice that the crown is much wider mesiodistally than it is labiolingually. Okay? Let me see if I can move my, I don't know how to move my screen here. Hopefully you guys can minimize it to see some of this stuff. Okay, so we have our maxillary lateral incisors, and our crown is now smaller than it was on the central incisors, but our root, get a different color here, our root is going to be much longer. Okay? Oops, sorry. Okay, now our cervical incisal length, that's this length from here to here, up to the incisal. Sorry, this isn't working very well. This is going to be greater than this. Oh. Okay, so unlike the central where those were flipped, right? Oh, my hair keeps getting out of control here. All right. Now the roots of the maxillary incisors, the root of deciduous maxillary incisors are really constricted at that cervical third. It's kind of like a rubber band around there. They are twice as long as the crown, and they taper evenly towards the blunt apex. And the mesial concavity, there is a mesial concavity on the root surface, but the distal is generally nice and convex, so nice and easy to clean. The lateral incisor is longer and more tapered than the central incisor. That's the roots, okay? All right, let's go down to the mandibular. Our labial aspect, this is the one, I want you guys to know this, I'm going to highlight it here. The one where mamelons or grooves may be visible. So this is our mandibular central incisors, okay? The mesial and distal taper evenly from the contact area, and the root is narrow, conical, and maybe 2 to 3 times the height of the crown. Okay, so the roots are pretty long here. The lingual aspect appears smoothly contoured and tapers towards the cingulum, but what I want you to know here is that the marginal ridges are less pronounced. Okay, do you see how that circle around the tooth isn't sticking out quite as much? All right, continuing with the mandibular central incisors, the mesial and distal aspects, just know that the incisal ridge is centered over the root. The labial and lingual cervical contours, oh, I just got a notification here. There we go. They contour quite a bit, so that's this contour here, okay? The cervical, oh, not sure what's going on there. Let's see if I can erase that. There we go. Okay, the cervical curvature is greater on the mesial than on the distal, all right? And that's kind of a general rule of thumb, right? As far as the incisal ridge is centered over the crown, and the labial surface appears flat with a slight convexity, and the lingual surface appears concave. Mandibular lateral incisors, they are wider and longer than central incisors. The cingula is more developed, and they are wider Labiolingually. I guess I can't do labiolingually here. They're wider going from the front to the back, okay? The incisal ridge slopes distally, so you can kind of see that slope here, right? And the distal margin is more rounded, okay? All right, roots of mandibular incisors. The root of lateral incisors are longer, narrower, more tapered than the central. They're also less blunt at the apex, meaning that they're more pointed, okay? They have distal longitudinal grooves on the roots. So longitudinal groove means a groove going up and down. And the mesial depression is running lengthwise. The mandibular central root is shorter and does not have the grooves or depressions on the root surface. So easier to clean. All right, maxillary canines, labial and lingual aspects. The crown is more constricted at the cervix and more convex on the mesial and distal surfaces. The facial lobes are well developed, and you can really see that. I think you can really see it here. 1, 2, 3. Okay, very well developed. We have a sharp cusp right here, and the root is about twice as long as the crown. On the lingual aspect, the mesial and distal marginal ridges and incisal ridge cingulum are all very pronounced. Okay, so you can really see those ridges here. Okay, cingulum, all right, and then our incisal ridge, especially here. Okay, may have a tubercle from the cusp tip to the lingual ridge, and the lingual ridge from the cusp tip to the cingulum. All right, maxillary canines, the distal and mesial aspect. Mesial and distal aspects are similar to the lateral and the central incisor. The crown and root at the cervical third is wider labiolingually than incisors. So labiolingually is going to be wider. On the incisal, the crown is really fairly rhomboidal, and the labial ridge is less pronounced. Okay, the cingulum is obvious, and the tip of the cusp is slightly distal to the center. Our mandibular canines are shorter and more tapered than the maxillary canines. So just like in the permanent dentition, they're just a little bit shorter, okay? They're flatter with shallow developmental grooves. The distal cusp ridge is longer, and the root is long, narrow, and twice the length of the crown. The lingual aspect, we're going to see a slight concavity, a lingual fossa, okay? Lingual surface is less prominent. It is narrow on the lingual side, more narrow on the lingual side than on the labial, okay? And that's with most teeth, right? It's going to taper to the lingual, except for the permanent first molars, right? Okay, so I think you guys can see that all there. Hopefully you're following along in your book. All right, mandibular canines, mesial and distal aspects. The incisal ridge is centered over the crown labiolingually. Okay, so the incisal ridge, this up here, is centered between this and this. Okay, labiolingual measurements are smaller than the maxillary incisal aspect. The incisal ridge is straight and centered over the crown labiolingually. Okay, and that's what it's saying up here also. It tapers towards the cingulum, meaning this tooth is tapering towards the lingual. The labial surface is flat with a slight convexity, and the lingual surface is flat with a slight concavity. That's what gives it that shovel, right? All right, roots of canines. Roots of deciduous canines are almost twice as long as their crowns. They're thicker than roots of the incisors. The apices are going to be more blunt. The mandibular root is slightly shorter than the maxillary and much more tapered. Both have roots tapering lingually and apically, and then they are triangular in cross section, just like their maxillary counterparts, right? All right, so let's go to 16.2, primary molars. And our objective here is to compare the dental anatomy features of the deciduous teeth with other deciduous teeth and with their permanent counterparts. Maxillary first molar, our buccal aspect. It's a blend of a premolar and a molar. So here is something you need to know, that this is unlike any other tooth, deciduous or permanent, doesn't matter. There is nothing like this, okay? I'm just going to put the little sign through there. Nothing like it. The most atypical of all molars, it's wider buccolingually, okay, than it is mesiodistally. There are two major cusps. We have our mesiobuccal and our mesiolingual. And then the distobuccal cusp is half as large as the mesiobuccal cusp. All right, maxillary first molars are lingual aspect. The crown converges towards the lingual surface, just like they do on the maxillary, right? Like most teeth, I should say, not like the maxillary. The mesiolingual cusp is the longest and sharpest, so that's a little bit different, right? The mesiolingual cusp is the longest and sharpest. The distolingual cusp is small and rounded, if it's present at all. There are three cusps, one lingual and two buccal. The lingual root is longer than the other two, and tiny tubercles on the mesiolingual cusp sometimes. And that wouldn't be a cusp of Carabelli, it's a tubercle, okay? Maxillary first molars, the mesial aspect. The cervical third buccolingual measurement is greater than the occlusal third. Okay, so what does that mean? The cervical third buccolingual, so this measurement is going to be greater than this measurement. Okay, you can see that, right? The mesiolingual cusp is more pronounced and longer than the mesiobuccal. Okay, so the mesiolingual, all right, cusp is more pronounced than the mesiobuccal. Okay, a major characteristic of the maxillary first molar is extreme convexity in the cervical third of the buccal surface. So, a lot of convexity. Right, our distal aspect, we're going to have a crown that's narrower distally than mesially. Okay, so this is going to be a little more narrow than our previous slide. The distal buccal cusp is more developed than the distal lingual cusp, so that's just opposite, right? So now here's our distal buccal and our distal lingual. There's a cervical convexity, a buccocervical ridge on the buccal surface, and this does not continue onto the distal surface, okay? So, here's our ridge right here, okay? All right, our occlusal aspect, the occlusal table appears triangular. You can kind of see that triangle, right? So it may only have 3 cusps, but it could have 4. If there are 4 cusps, there's going to be 2 on the buccal and 2 on the lingual. If there's 3, you're going to have 2 on the buccal, 1 on the lingual. Okay. Similar to permanent molars, but the occlusal table is much smaller. The central groove between the central and mesial triangular fossa. Okay. All right. The buccal developmental groove divides the buccal cusp. So if you look here, you can see the buccal groove. And that would be, let me correlate these a little bit. That would be this right here and this right here. Okay? The mesiofacial triangular and mesial marginal and mesiolingual triangular grooves originate in the mesial pit. Okay? The distal facial and mesial developmental grooves radiate from the central pit. There are 3 fossa on the forecusp form. We have the mesial, central, and distal. There is a small pit usually present in each fossa. Grooves originating at the distal pit are distal facial triangular and distal lingual, distal marginal. And the oblique ridge runs from the distal buccal cusp to the mesiolingual cusp. Okay, so it's kind of those 2 smaller cusps, right? Okay, and I'm going to pause here for a little bit. Okay, maxillary first molar roots. We have 3 roots, just like we do in our permanent dentition. We have 2 buccal, a mesial buccal and a distal buccal, and 1 lingual. They're very long and slender. They're really flared, and that's just to allow that premolar to sit kind of in those roots and resorb them, okay? The lingual root is going to be longer and more curved, and it tips buccally at the apex. So that's a little bit different, right? The mesial buccal root is the next longest, and the distal buccal root is the shortest. The root trunk of is trifurcated, meaning it's splitting into 3 roots above the cervical line, and small compared in length to the length of the roots. Each root has a single root canal, okay, but we don't do root canals on children. They'll do pulpotomies where they just take it out, but they don't fill it in because that root's going to be resorbed, so there's no point in putting a filler in there, right? And just know that the trunk is really short on these, okay? And that's just so that it can, like I said, it can just be resorbed really easily. All right, our maxillary, I have to move my camera here so I can see this. Our maxillary second molars, the buccal aspect, is similar to the permanent first molar, okay? I'm going to highlight that because this is true of all the second deciduous second molars. So it's similar to the first molar, only very small, okay? Has 2 equally sized buccal cusps with a buccal groove. The crown narrows at the cervix and is much longer than the deciduous first molar, or excuse me, larger, okay? So let's take a look at this, right? So 2 buccal cusps, equal in size, 1, 2, okay? And then here's our buccal groove. Okay, here's the lingual aspect of our second molar. Again, this tooth is similar to the first molar of the permanent dentition. So we have 3 lingual cusps, a mesiolingual, a distal lingual, and the tubercle of Carabelli, not cusp of Carabelli. It is now the tubercle, and that is, get my eraser, bloop. Okay, that is right here, and our anatomy is the same as the permanent first, so it is on the mesiolingual cusp, okay? The mesiolingual cusp is going to be our larger and more well-developed cusp, and then the distal lingual is smaller in comparison. Then our tubercle of Carabelli is really just a poorly developed lingual, poorly developed on the lingual side. Again, mesial lingual cusp, so it keeps it easy, simple and easy, right? If you're asked where the cusp of Carabelli is, that's the permanent first molar mesial lingual cusp. If you're asked where the tubercle of Carabelli is, that's the deciduous second molar, maxillary second molar, again on the mesial lingual cusp, okay? The lingual developmental groove separates the mesial lingual and distal lingual cusp, and that is right here, okay? Maxillary second molar, the mesial and distal aspects. The second molar crown is longer and wider than the first molar, and the roots are longer. I'm not sure why all these pictures shifted. The first molar and roots are longer. Okay, the lingual root curves the same way as the first molars, and the cusp of Carabelli, or the tubercle of Carabelli, is visible on the lingual and apical to the mesial lingual cusp. It is large in comparison to the mesial buccal cusp. All right, on the distal aspect, the crown appears smaller than from the mesial aspect. You can see how big this looks, and then how much smaller, this looks, right? The distal buccal and distal lingual cusp are the same length, so you can expect this here to be the same as this. I'm not sure what's going on with my computer, why it's erasing some of these things. And then we have a straight cervical line, and that's right here. Okay, as far as the occlusal aspect, again, it's going to resemble that of the permanent first molar. We're going to have the mesial buccal cusp, distal buccal cusp, the mesial lingual cusp, distal lingual cusp, and then the tubercle or cusp of Carabelli. The mesial lingual is the largest, the distal lingual is the smallest, except for our fifth cusp, right? Just like it is with the permanent maxillary first molar. Developmental grooves are less defined and almost identical to the first permanent molar, okay? Maxillary second molars, the roots, you're going to have 3 roots. Again, 2 buccal, 1 lingual. The longest root is going to be the lingual, the shortest is going to be the distal buccal. The mesial buccal root may be as long as the lingual, and then the root trunk is short. Each root has only 1 root canal. Let's start with our mandibular molars now. Our first molar, the buccal aspect, we're going to see a mesial outline that is flat, so pretty much straight up and down here, okay? I can hardly see that yellow marking there, but it is there. The distal outline is going to be more convex and converges sharply at that cervical line. So you can see it goes bloop and then right in, okay? The distal portion of the crown is shorter than the mesial portion of the crown, and you can see that pretty obviously there. 2 distinct buccal cusps and a developmental groove that isn't always evident, so you may or may not see it. A lot of times you just see it as flat there, no groove, okay? The mesial cusp is larger than the distal, and the crown is wider mesiodistally, so just to keep orienting you guys with this, mesiodistally, okay? So it's wider mesiodistally than it is buccolingually, which I can't draw here because we can't see that surface, right? The roots are long, slender, and flared. Again, it's just so that that premolar can fit in here and help with destroying or resorbing, I should say, these roots, okay? Point of bifurcation is very close to the cervical line. You can see that here. Not much of a root trunk. And again, that's just because it doesn't, it just gives it more to resorb, right? All right, from the lingual aspect, the crown and root converge on the mesial. They do not converge distally. The mesial lingual cusp is long and sharp. Okay, so you can see that right here. The marginal ridge is well developed, and the cervical line is straight across. Okay, and the buccal cervical line curves apically at the mesial half of the tooth. Okay. On the mesial aspect here, we're going to see the most characteristic trait is that it's bulbous curvature on the buccal at the cervical third. So when you look at this curvature here, right? Oh boy. I need a computer with a pen here. All right. The mesial buccal cusp is longer than the mesial lingual cusp. You can see that here. Mesial buccal, mesial lingual. Same with down here, mesial buccal, mesial lingual. All right, the cervical line curves up from the buccal to the lingual. Okay, so you can see this line starts down here and ends up here. The buccal flat surface from the tip of the mesial buccal cusp to the crest of the buccal cervical curvature. The buccal surface above the curvature is rather flat and tipped at a sharp angle towards the buccal cusp. Okay, so you can see that angle here. Oh boy. All right. The mandibular first molars, the distal aspect, the height of the cusp appear more uniform, so they're going to be a little more level. You can see that here and here. Okay. The cervical line is straight. You can see it a little more on this picture than the other. The distal buccal and distal lingual cusp are not as developed as the mesial cusp. The distal marginal ridge is not as well defined as the mesial marginal ridge. The distal root is going to be rounder and shorter than the mesial, so you can actually see the mesial behind it here. Okay, and it tapers apically, only one root canal, okay, in this distal root. So just imagine one canal in here. The distal surface is more rounded and convex. All right, so now let's look at the occlusal. It is rhomboidal. We talked about that being kind of a crooked rectangle, okay? It's most prominent on the mesial buccal surface and the cervical ridge. The mesial lingual is the widest cusp, and the mesial marginal ridge is the most developed. Okay, so our ridge here is the most developed. The buccal developmental groove may be present, and that's right here. Ugh. Okay. The transverse ridge runs between the mesiofacial, or the mesial buccal, and the mesial lingual cusp, dividing the occlusal into two fossa. Okay, so it goes from here to here. Okay, one fossa contains the mesial pit, and the other contains the central and distal pits. All right, all are joined by the central developmental groove. So here's our pits, 1, 2, 3, and they are all joined by this groove right here. All right, the lingual groove radiates from the central pit between the two lingual cusps, and the facial groove runs from the central pit to the buccal surface between the two, separating those two buccal cusps. The mesial and distal triangular fossa and the mesial and distal marginal and triangular grooves are seen on the occlusal aspect. Okay, mandibular first molar roots. We have two roots, just like on the permanent dentition, right? You're going to have a mesial and a distal. They are broad and flat. They're flared, just like all of them are, right? The mesial root has a longitudinal developmental groove and two root canals. Okay, so this is just like our permanent teeth. Two canals in the mesial root. The distal root is shorter, thinner, and only has one canal. All right, here's our second molars. These again resemble the permanent mandibular first molars, except that they're smaller and with constriction at the cervical area right here. You can see how constricted that is. So the way I always remember this is that the tooth, so when your permanent dentition comes in, it comes in directly behind these teeth. So you have twins right next to each other, okay? So the primary second molar is going to be next to the permanent first molar, whether it's maxillary or mandibular. And they're kind of twins, only one twin got all the nutrients and one twin didn't, so one's much bigger than the other. That's how I always think of it. So they come in next to each other, okay? The mesial buccal and distal buccal grooves are divided into three cusps, a mesial facial, a distal facial, and a distal, just like our maxillary first molar. The cusps are about equal in length and width. The distal buccal is slightly longer. The roots are long and slender, and they flare mesiodistally at the middle and apical thirds. The point of bifurcation, again, is right below that cervical crown. And what that means is there's a short root trunk. Okay, that's all that means. And all of the deciduous molars have that. So that's not a differentiating factor, something that makes it different than the others. All right, on the lingual aspect, we have a short lingual groove that divides the mesiolingual and distal lingual areas. That's right there. And these are about the same size, okay? The lingual cusps are equal in length and narrower than the buccal cusp. So when we look at the length, they're pretty equal, just like they were in the first primary mandibular first molars, okay? The tooth converges lingually and the cervical line is straight. On our mesial aspect, our buccal surface has a cervical bulge. Holy smokes, does it ever, right? Big old bulge. We have to think of that as far as plaque retention, right? That would be an easy area. This right here would be a really easy area for plaque retention. And how important is it for that kid to get their brush in at the right angle? Well, a lot of times they don't have the proper dexterity, so we need to have the parents help them out a little, okay? The crest of contour on the buccal side is less than the deciduous first molar. The flattened buccal surface angle occlusally from the crest of the contour, okay? So we're getting flat as we go up, okay? Proportionally smaller occlusal table than on the permanent mandibular first molar, so it's just a little more compact. The mesial marginal ridge is rather high. The cusp appears to be shortened because of this high marginal ridge. The lingual cusp is longer than the buccal cusp. Okay. So the lingual cusp, you can see it here, I think better, is higher than this cusp. Okay. The cervical line extends up on the buccal side to the lingual. Okay, so again, the lingual is going to end a little higher than where the buccal started. And then the root is really broad, flat, and blunted. And remember, this has two canals, one apex and, sorry, my computer keeps doing something funky here, and I couldn't join those together, but they should be joined together here at the apex. Oh, here we go. I don't know why it keeps doing that. There we go. All right, so this is just like the permanent mandibular molars, right? Two first molars, two in the buccal, one in the distal. All right, our distal aspect, again, this is going to have one canal. Okay, this root is going to be a little bit shorter than that of the mesial, but it's still really broad and flat. The crown is not as wide distally, so you can see more of the buccal and lingual surfaces because it's not as wide. The distal marginal ridge is not as high, so you can see more of the occlusal table. Okay. The cervical line is the same has the same upper inclination. Okay, here to here. Inclining buccal lingually as the mesiocervical line. And then three cusps, we have the distal facial, distal, and distal lingual that we can see here. Here's our distal, here's our distal facial, and our distal lingual. Looking at our occlusal table, all cusps are about equal in size. The mesiodistal width of the three buccal cusps is much more than two lingual cusps. So our mesial is going to be high or wider than our distal, and that's pretty typical, right? Because we're converging towards the lingual, and that helps us get into those embrasure spaces. The mesiofacial, distal-facial, and lingual grooves radiate from the central pit. So here's our central pit. Here's our lingual groove, our mesiobuccal, and our distal buccal. Okay, so you can see how that forms a Y. The central developmental groove joins the mesial triangular fossa and pit. The supplemental grooves on the triangular ridges, and there are supplemental grooves on the triangular ridges and fossa. And then the mesial marginal ridge is more pronounced. So this ridge here is going to be more pronounced than this ridge here. Okay, and you can kind of see that. I don't know if my video is covering this, but you guys can look in your book, but you can really see it, I think, quite well on the picture of the occlusal surface. The crown converges distally and lingually, so it's going that way. All right, and the narrow buccal lingual dimension it has a narrow buccal lingual dimension compared to the mesiodistal dimension. All right, mandibular second molar roots. They are twice as long as the crown, so pretty much a general rule of thumb is that the deciduous teeth, their roots are going to be twice as long as their crowns on almost everything. Okay, they're going to be long and slender, widely flared. The trunk is going to be short. It bifurcates because there's two roots, and it does that right below the cervix. And then it has two roots, one mesial that has two root canals and one distal that has two root canals. That mesial also has, I'm sorry, did I say two? So mesial that has two, distal that has one. But remember that mesial has a really deep developmental groove. And I always picture that developmental groove as one that would separate the two canals. Okay? If you have any questions, please let me know. Otherwise, I think that, oh, we got one more slide. Okay, pulp cavities of deciduous teeth. Remember that the pulp cavities are quite large, and that reduces the amount of dentin in there. So the pulp cavities mirror outer form of the teeth, except pulp horns that are longer and more pointed, okay, which doesn't give us as much room for decay in there. The pulp chambers are large in portion to the tooth size shape, and the pulp horns are more extreme. Mandibular deciduous molars are like miniature permanent teeth. Remember that maxillary first molar doesn't look like anything, okay? So the mandibular first molar kind of resembles a little bit of premolars, a little bit of molars, but that maxillary first, that's the one that really gets you, and it's not like anything else, okay? All right, hope this helps. Take care, you guys. Bye-bye.